Imagine waking up every morning in severe pain, finally finding the courage to see a doctor, and being told that nothing is wrong or that it's simply stress or anxiety. Now imagine hearing that over and over again while your pain continues to get worse. Although many of us are healthy today, nearly everyone knows someone who lives with chronic pain or may experience it themselves later in life. Understanding this issue can help us to become more informed patients, more compassionate healthcare professionals, and better advocates for people whose suffering is often invisible. Today, I want to discuss healthcare bias against people with chronic pain and explain why this overlooked issue affects millions of people every year. When choosing a speech topic, I want to learn more about an issue that affects many people but is often misunderstood. After researching medical journals, government health organizations, and patient advocacy groups, I realized just how common and damaging this form of healthcare bias truly is. Today, I will explain why healthcare bias exists towards people with chronic pain, how this bias negatively affects their lives, and the everyday challenges people with chronic pain face because of these experiences. To understand why this problem exists, we first need to understand why chronic pain is so difficult for healthcare providers to evaluate. Many chronic pain patients experience healthcare bias because their condition is difficult to see and measure. Unlike a broken bone or an injection, or infection, many chronic pain conditions leave no obvious physical evidence. Conditions such as complex regional pain syndrome and certain nerve disorders often do not appear directly on X-rays, MRIs, or routine blood tests. Doctors must rely heavily on what patients describe about their symptoms, but unfortunately, because providers cannot always observe physical evidence, some patients are viewed as exaggerating their symptoms or imagining their pain altogether. This can lead to patients feeling dismissed before they've even received the proper evaluation. According to the National Institutes of Health, chronic pain affects millions of Americans and remains one of the nation's leading causes of disability. Despite how common it is, many patients continue to struggle to have their pain taken seriously. Another reason this bias exists is because of concerns surrounding opioid misuse. Over the past 2 decades, physicians have faced increasing pressure to reduce opioid prescriptions in response to the opioid epidemic. While these efforts were intended to reduce addiction and overdose deaths, they have also created unintended consequences for some legitimate chronic pain patients. Some individuals report feeling like they are treated as potential drug seekers rather than people genuinely looking for medical care. This atmosphere of suspicion can make patients hesitant to discuss their symptoms honestly, even when they are experiencing severe pain. Healthcare providers hold significant authority over diagnosis and treatment decisions. While patient experiences are dismissed simply because their pain cannot be objectively measured, that imbalance of power can leave patients without proper care or even a meaningful voice in their own treatment. Unfortunately, these biases have consequences that extend far beyond a frustrating doctor's appointment. Healthcare bias can have lasting physical, emotional, and social consequences for people living with chronic pain. One of the most serious consequences is delayed diagnosis. Many patients spend years searching for answers before finally receiving an accurate diagnosis. During that time, untreated symptoms often become more severe, leading to reduced mobility, worsening health, and a lower quality of life. According to the Centers for Disease Control and Prevention, chronic pain is associated with decreased mobility, higher healthcare costs, and lower overall quality of life. Beyond the physical effects, repeated dismissal can also damage emotional well-being. Imagine constantly being told that your pain is not real or you're simply overreacting. Over time, many patients develop anxiety, depression, frustration, and feelings of isolation. Even worse, repeated negative experiences can cause people to lose trust in healthcare providers altogether. Some delay seeking future medical care because they fear they will once again be ignored or judged. When healthcare professionals have the authority to determine whether a patient's pain is believed, individuals with invisible illnesses often have very little control over their own treatment. This imbalance can leave patients feeling powerless and often misunderstood. Healthcare bias towards chronic pain patients also creates challenges that affect daily life, employment, and independence. Many people living with chronic pain struggle with routine tasks that most of us rarely think about. Activities such as going to work, exercising, grocery shopping, cleaning the house, or even getting out of bed can become extremely difficult because of the persistent pain. Since chronic pain is often invisible, family members, coworkers, or even close friends may not understand what someone is experiencing. Instead of receiving support, patients are sometimes unfairly viewed as lazy, unmotivated, or even exaggerating their symptoms. According to the Centers for Disease Control and Prevention, high-impact chronic pain frequently limits both life and work activities, making it difficult for many individuals to maintain employment and participate fully in everyday life. These struggles often extend into the workplace as well. Many people with chronic pain are unable to maintain consistent employment because their symptoms can vary from day to day. One day they may feel well enough to complete their job, while the next day they may struggle just to make it through the day. This unpredictability can make holding a steady job extremely challenging. Even when people request reasonable workplace accommodations or apply for disability benefits, they often face additional obstacles because invisible illnesses can be difficult to document and verify. Without obvious physical evidence, they may feel they have to constantly prove that their condition is real. Because chronic pain often cannot be seen or measured through standard medical tests, many patients find themselves repeatedly trying to justify their condition, not only to healthcare providers, but to employers, insurance companies, family members, and even friends. The emotional stress of constantly defending yourself can become another burden on top of the pain itself. Now that we've examined why healthcare bias exists, how it affects patients' health, and the challenges it creates in everyday life, let's review the key ideas. In conclusion, today we discussed why people living with chronic pain often experience healthcare bias, how this bias affects their health and emotional well-being, and the everyday challenges they face because of these experiences. Pain isn't always something we can see, but that doesn't make it any less real. The next time someone tells you they're living with chronic pain, remember that their experience may never appear on an X-ray or blood test, but that doesn't mean their suffering isn't genuine. Simply listening, believing, and treating people with empathy can be the first step toward creating a healthcare system that is not only more effective, but also more compassionate and equitable for everyone. Thank you.